Hello, everyone. My name is Terrence Tarver. I'm a doctoral level practicum student here at the Student Counseling Center. And today I'll be giving a presentation on stress and relaxation. So, stress is an everyday fact of life that we can't avoid. Stress results from any change you must adapt to, ranging from the negative extreme of actual physical danger to even enjoyable life events like falling in love or reaching a long term goal. And when we look at stress, we see that it comes from four main sources. So your environment bombards you with demands to adjust. You may have to endure changes in weather, traffic, construction, not being able to find parking before class, or noisy roommates. We also see that you have to cope with your social stresses as well. So, for example, demands for your time and attention from family, friends, and significant others, job and internship interviews, class deadlines, presentations, fights with your roommates, figuring out how you're going to pay for the next semester, breakups, and maybe even the loss of a loved one. We also see that our physiological responses are affected by stress as well. So, for example, not having time to exercise, poor nutrition, not getting enough sleep, binge drinking, illness, injuries, and aging all tax the body. Your physiological reaction to environmental and social threats and changes can result in stressful symptoms. For example, you may experience muscle tension, headaches, nausea, digestive issues, anxiety, and depression. Our thoughts are also stress inducing as well. Your brain interprets complex changes in your environment and body and determines when to turn on the stress response. How we interpret and label our present experiences and what we predict for our future can serve to either relax or stress us. For example, interpreting a mean look or terse email from a professor to mean that you're doing an inadequate work in class is likely to be very anxiety provoking. But if you interpret the same look as tiredness or preoccupation with personal problems, you're probably not going to be as scared or stressed. Sometimes stress can start with our own appraisal of situations and our thoughts. So the techniques that we'll be teaching you will fall into two categories: relaxation techniques that focus on relaxing the body, and stress reduction techniques that condition our minds to handle stress effectively. Your mind, body, and emotions are interrelated. So when you're seeking relief from stress, you get the best results when you use at least one technique from each of the two broad categories. Today we're going to focus on relaxation techniques. So when we start with the breathing, we understand that breathing awareness and good breathing habits will enhance your physiological, psychological, and physical well-being. As we learn to be aware of breathing and practice, slowing and normalizing our breaths, the mind will be quiet and the body will relax in time. So now we're going to take a look at our breathing patterns. And the first breathing pattern that we're looking at is the one that we want to avoid, which is chest or thoracic breathing. It can contribute to anxiety, panic attacks, depression, muscle tension, headaches, and fatigue. And it's the shallow, irregular, rapid breathing that we seem to experience when we're in a high stress situation. So when do you notice that you're doing this breathing, or when do you notice signs? You can notice the signs that are when air is inhaled, the chest expands and the shoulders rise to take in the air. We also find that chronic chest breathing or frequent breath holding can be associated with chronic stress, tension, poor posture, tight clothing, purposely holding in the stomach and pushing out the chest, sedentary lifestyle, painful feelings, or long periods of focus of tension in which people forget to breathe regularly. In acute or extreme cases, this type of breathing is easily recognized as hyperventilation, but milder and slower chest breathing can go unnoticed for years. So the type of breathing that we want to enforce and that we want to do more of is what we call abdominal or diaphragmatic breathing. This is the natural breathing that babies have or that sleeping adults have. And so with diaphragmatic breathing, we are breathing in deeper and slower than the more shallow chest breathing, and it's a more rhythmic breathing and relaxing. By increasing your awareness of your breathing patterns and shifting to more abdominal breathing, you can balance oxygen and carbon dioxide levels, normalize heart rate, and also reduce muscle tension and anxiety. So it's time for us to practice our breathing. And so breathing exercises have been found to be effective in reducing general anxiety disorder, panic attacks, agoraphobia, depression, irritability, muscle tension, headaches, and fatigue. So what I would like for us to do now is to go through a short diaphragmatic breathing practice and then take some time to reflect at the end about what did you like about it, what did you not like about it, and just some tips and tricks for you as well. So to begin this practice, sit up tall with your feet planted firmly on the ground and imagine each of your vertebrae stacked one on top of the other, all the way up your spine, with your head resting comfortably atop your shoulders. You can close your eyes if you like, or if you prefer, leave them open slightly, allowing your gaze to rest unfocused on a spot on the floor a few feet in front of you. Many of us develop the habit of breathing into our chest and tighten our abdomen as we move throughout the business of our lives. So it may take a few moments to find a comfortable rhythm of belly breathing. Place one of your hands, palm open, flat against your belly, just above the belly button. Place the other flat, open against your chest. Allow the muscles in your abdomen to relax. Let your stomach expand and deflate as you breathe down into your belly. Breathe again, pull the breath all the way down to your abdomen, allowing it to expand. As you continue breathing this way, see if you can notice your chest standing still and your abdomen expanding and collapsing. Feel your hand rising and falling with the rhythm of your breathing, and see if you can intentionally take in more air with each in breath, intentionally exhaling more with each exhale. Notice any changes that occur by breathing this way. You can leave your hand on your belly as long as you like, or when you feel at ease, maintaining a gentle awareness of the breath traveling down into your belly. You can place your hand wherever feels right to you. Now take one more deep, full inhalation, and then imagine that your belly button is trying to reach all the way back to your spine as you slowly and completely exhale. When you're ready, you can open your eyes and return your attention to the world around you. Now that we went through this short practice, I want you to take a minute or so to just reflect on what you were feeling during this exercise, what worked for you, what didn't work for you, and just do some self reflection. And so we'll take 1 minute to do so. Now that you've taken time for some self-reflection about this practice, let's continue with the presentation. A second skill that we would like to introduce to you, excuse me, that might be useful and actively trying to relax your body is progressive relaxation. When you practice progressive relaxation, or also known as PMR, you focus on the sensations of tension in one particular muscle group at a time. Then, when you release that tension, you focus on the sensations of relaxation in that same muscle. When mastered, deep muscle relaxation can be used to significantly decrease anxiety, muscle tension, depression, fatigue, insomnia, neck and back pain, high blood pressure, mild phobias, and stuttering. So the idea behind this skill is again to tense one particular muscle group and notice the tension that you have within that muscle group and then release, and then to also recognize the sensations that you get from the release of the tension. This is this technique has found excellent results within anxiety and stress research, also within counseling psychology, as well as sports psychology of the effectiveness of how it works. So progressive relaxation for your muscle produces reduced pulse rate, blood pressure, startle reflex, and respiration rates as well. So now it's time for us to practice progressive muscle relaxation. So I'll go through a short script with you all on PMR. And just as we did with the diaphragmatic breathing practice, we'll take a minute after to just reflect and begin to see what you like, what you don't like about it, and also just to reflect upon it. So we'll start this exercise. I'll ask you all to sit back or lie down in a comfortable position. Shut your eyes if you're comfortable doing so. Begin by taking a deep breath and noticing the feeling of air filling your lungs. Hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now. Take another breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Now move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to this tension and notice what it feels like. Release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. Release the tension from your lower legs. Again, notice the feeling of relaxation. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in, squeeze harder, and hold the tension a little bit longer. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold. Release the air slowly. Feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tight. Tense them as hard as you can without straining and keep holding. Release the tension from your back. Feel the tension slowly leaving your body and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm. Hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation from your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension. Again, notice the new feeling of relaxation. Finally, tense your entire body. Tense your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining and hold the tension. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Begin to wake your body up, slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. So again, just like we did with the diaphragmatic breathing exercise, I'd like you all to just take a minute to reflect and just think about what you liked about the exercise, what you didn't like about the exercise, and again, just time for self-reflection. We'll take a minute to do that as well. Imagine I've taken a minute or so to do some self-reflection about the PMR exercise that we just did. Let's continue with the rest of the presentation. So Google deep breathing exercises and progressive muscle relaxation or search them on YouTube. There's a wealth of resources out there. Practice using these skills every day over the next week to become better at the skills that you like and to make them more effective for you as well. So what do we do now? We have to practice diaphragmatic breathing and progressive muscle relaxation and decide which one that you like the most. Again, it's okay if one doesn't work for you. The key importance is to find one that works and continue to practice that skill. Set aside about 10 minutes every day to practice a skill. You don't have to try to set aside an hour or anything like that. Just 10 minutes out your day to just practice a skill. And the great thing is you can practice anywhere. You can practice it in class, in the library, on the bus, or at home, wherever you may choose. A quiet place is ideal, but the relaxation effects can happen anywhere. And also just picking out from the previous slide to keep you accountable. Again, YouTube videos are great as well. And we want to continue to practice these skills to improve your ability to relax your body and your nervous system when you feel stress. That brings us to the conclusion of this presentation. Again, my name is Terrence Tarver, and I thank you all for joining me today for stress and relaxation.